Good afternoon. Last night, Baltimore City reported its first confirmed case of COVID-19. The city was prepared for this possibility, and I took a number of executive action in advance to protect the health and well-being of our residents. Today, I'm here to announce additional steps we are taking to limit the spread of COVID-19 Baltimore. Starting tomorrow, all senior centers and recreation centers will suspend programs. These centers will be kept open as food distribution centers and access hubs. The City of Baltimore has activated sheltering in place for our homeless neighbors. City-funded homeless day centers will remain open. Health, MOHS, and DGS are working to identify a site for community quarantining should our city require it. The City of Baltimore will only accept payments online and by mail. Late fees are suspended through at least May 1st. Payment windows at the Abel Woolman building will be closed. The City of Baltimore will only accept permit applications online. This includes Department of Transportation, Recreation and Parks, Health Department, Department of Public Works, and Department of Housing and Community Development. All licenses that expire March the 5th, 2020 and after are extended 30 days until after the end of the state of emergency that was declared by Governor Hogan. The City of Baltimore is suspending in-person services at the city's career and youth opportunity centers. Staff will provide services and appointments by telephone. Effective Wednesday, March 18th, all Baltimore City employees designated as telework eligible will be required to work from home or remote locations until further notice. And finally, all city employee work-related travel is suspended until further notice. At this time, it is critical that we all follow best practices to limit exposure to ourselves and our fellow residents. This means social distancing of at least 6 feet of space between yourself and another person, washing your hands with soap and warm water often, using hand sanitizers that are at least 60% alcohol based. Don't touch your face, clean high touch point areas often, cough into your elbow, not your hands. I want to stress that these 2 weeks are not a vacation for our youth out of school or for residents sent home from work. This is not time to hang out with friends or go catch the latest movie. I implore everyone to take care of your neighbors at this time. It's not just about you, it's about all of us. The most important thing you can do to reduce the risk of spread in Baltimore is to stay home and maintain social distancing practices when you must go out into the public. We must flatten the curve, and this is our opportunity in Baltimore City. Now I will turn it over to our Health Commissioner, Dr. Letitia Sarasa.
Thank you. As Mayor Young announced yesterday evening, the Health Department was informed by the Maryland Department of Health that we have had our first positive case of COVID-19 in Baltimore City. At this time, all we are able to share is that this initial case is a male in his 60s who is currently stable and undergoing medical evaluation at a local area hospital. A contact investigation led by the Health Department is underway to determine who the patient has been in close contact with recently. We believe this to be a case of community transmission. In the days and weeks to come, we expect the number of positive cases in Baltimore City to increase. Therefore, I would like to review 3 major points. First, not everyone needs testing for COVID-19. Second, taking extreme measures to enforce social distancing is paramount to protecting the health of our most high-risk residents. And third, continue to take everyday preventative measures. The first is in relation to testing. Not everyone needs a test for COVID-19. Testing is most appropriate for folks who have either been severely ill with the symptoms similar to those indicated by COVID-19, cough, fever greater than 100.4, or shortness of breath, anyone who has been in close contact with a person known to have COVID-19, or someone who has lived in or recently traveled from an area with ongoing spread of COVID-19. If everyone with mild symptoms attempts to go to the hospitals at the same time, we will overburden our hospital system. Instead, residents should consider whether their symptoms are mild or extreme. If your symptoms are mild, but consistent with COVID-19, including cough, fever of greater than 100.4, and shortness of breath, call your doctor or healthcare provider, and they will help to determine whether or not you should receive a test. If you are at higher risk of serious illness related to COVID-19, which includes those over the age of 60, or those with a heart condition, lung disease, or diabetes, monitor yourself for cough, fever, and shortness of breath. Additionally, pay attention to emergency warning signs. So if you notice difficulty breathing, persistent pain or pressure in your chest, new confusion or significant lethargy, or bluish and grayish lips or face, get medical attention immediately. If you do not have a primary care physician, call 211 and ask for a list of public clinics in Baltimore, or visit health.baltimorecity.gov for a list. At this time, only a doctor can refer you for testing if they believe you qualify. The second major point is this need for social distancing. Social distancing is the most important step that everyone in our community can take at this time to prevent the rapid community transmission of COVID. Social distancing is intended to slow down the outbreak in order to reduce the chance of infection among our high-risk population and to reduce the burden on healthcare workers in our system. Experts describe this as flattening the curve, which generally refers to the potential success of social distancing measures to prevent surges in illness that could overwhelm our healthcare system. Please consider limiting going out to bars, restaurants, movie theaters, and other areas where you can come into close contact with other people. If you must go out, practice being at least 6 feet away from others. Even if you are not a high-risk individual for developing more serious symptoms, you may inadvertently spread the disease to a loved one who is at high risk. Please use your best judgment and institute social distancing. Finally, everyone should consider taking everyday precautions, including avoiding close contact with people who are ill and implementing the personal protective measures. This includes things like washing your hands for at least 20 seconds with warm water and soap, as well as using an alcohol-based hand sanitizer that's at least 60% alcohol if warm water and soap are not available. To the extent possible, avoid touching high-touch surfaces in public places. This includes things like elevator buttons, door handles, handrails, or handshaking with other people. Always use a tissue or your sleeve to cover your hand or your mouth, and throw that tissue away and wash your hands afterwards. Avoid touching your face, your eyes, your nose, and your mouth. Clean and disinfect your home to remove germs, and practice routine cleaning of very frequently touched surfaces. I can't stress enough the importance of implementing social distancing measures at this time. I'm pleading with you to consider your fellow resident, your older neighbor, your family friend, or your grandparent, who may be at risk for severe complications from COVID-19. If you walk away with one message today, that message is to participate and encourage social distancing. I'll now turn it over to Chief Ford.
Good afternoon. As COVID-19 continues to progress and our members continue to navigate through this pandemic, our priority continues to be the safety of our community and the safety of our members. There is no question that EMT and firefighters have some of the greatest risks in the widespread virus, which is why, since Governor Hogan declared a state of emergency and Mayor Young made the decision to shut down and suspend city events, we've strengthened our protocols. When our members come in contact with any patient suspected to be a PUI, patient under investigation, they are required to wear gloves, N95 masks prior to entering someone's home, a nursing home facility, and/or a hospital. Additionally, we have communicated the we've communicated the recommended prevention practices from the CDC throughout the department that emphasizes hand washing frequently, covering their mouths and nose with a tissue or their sleeves, and washing their hands afterwards, avoiding touching their eyes, nose, or mouth, and to practice good health habits. We also want to be sure that residents are only utilizing 911 in true emergencies. All non-emergency calls should be directed to 211 to prevent inundating the emergency department and emergency system. If residents must call 911 for help, we urge them to provide as much information as possible and to promptly and correctly give resources, give correct information in order for us to send the proper resources.
At this time, I'd like to introduce Chief Savela, who is the Acting Director of Office of Emergency Management.
Thank you, Chief. Good afternoon. We have fully activated the Emergency Operations Center and Joint Information Center at this time. We have city leadership, emergency management, and agency personnel working around the clock to closely monitor the situation and respond as needed. We are fully prepared to mobilize any necessary city resources at this time. We are also working with our local, state, regional, and federal partners to stay abreast of all activity as it relates to suspected and confirmed cases of COVID-19. We will disseminate more information as it becomes available. Thank you.
Thank you all for your hard work and dedication to the people of Baltimore. We will continue to update the public as the situation changes or as new information becomes available. Again, thank you.